And ladies and gentlemen, thank you for standing by and welcome to the California eHealth Stakeholder Webinar Conference Call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during the call, please press star, then 0. As a reminder, today's call is being recorded. I would now like to turn the conference over to our host, Ms. Pam Lane. Please go ahead.
Good afternoon, everyone, and welcome to the December Stakeholder Call. We are delighted to have you here. It is so difficult at this time of year to pull people away from all their activities, and I'm glad that you joined us. It's difficult also for me to realize that another year has gone by. Here we are in December, and it has been an incredibly busy year for all of us. One of the things that we did was to develop a very short and succinct eHealth vision for California, and you can see it there on your screen. And of course, we developed eHealth goals to go along with it. And those goals, of course, are to enhance individual and population health outcomes, ensure secure data access, and engage patients and families as partners in care. As I start, I would like to remind all of you that you can communicate with us as well as stay engaged and up to date on what's going on in the eHealth world in California by accessing our website that you will see on slides throughout today's presentation. It is ehealth.ca.gov, and we hope that you will utilize that website as well as the new Cal-OHI website, which is OHI with 2 I's.ca.gov. One of the things that you will find on the website is the videos from our Stakeholder Summit that we held early in November, actually the 1st and 2nd of November. And I wanted to do a recap. I saw many of you there. It was very exciting. Our speakers were very engaging as well as informative, and it's a great opportunity for me not to have an opportunity to put names and faces together, but also to have a chance to talk with you individually as well as collectively about what's happening and what you would like to have happen regarding eHealth in our state. We have about what's happening and what you would like to have happen regarding eHealth in our state. We have development that would be necessary and would be welcomed by the community. So we are in the process now of pulling together a group who will work on our MMPA Release 2.0. And we know that that will be a living document, but we are delighted that it has been received so well and that the feedback to us as to where we can make changes is already starting to come in. We also want to point out to you that there is now a national health IT dashboard, so you can follow EHR adoption in many different ways. It's a very interactive website, and I have pulled up some of the visuals for you to take a look at as we look at where California is relative to the rest of the country. You can virtually set up your own reports in this website. It will become more robust as national data is more available. But this first slide is a representation, as you can see, of physicians who are actively using their EHRs for e-prescribing. And the divisions of the colors are listed in the lower left, the lower right hand. You can see that California is at 35%. That's a very important number when we then compare it to, well, we can actually break it down further and see where in California that activity is occurring, that e-prescribing from EHRs. And again, the rates over on the lower right-hand corner show us, interestingly enough, where the divisions in percent of this utilization are occurring. Not surprising to those of us who've been around the HIE world for a while that some of our areas that were early adopters do have higher rates specifically to e-prescribing, but that you can find your county on that graphic and figure out what the e-prescribing percent in your community and county are. And you can see that the ranges are all over the board for California. When we compare that 35% number for physicians actively using EHRs for e-prescribing in California, and we look at this in a different way, this is actually the percent of community pharmacies who are able to participate actively in e-prescribing. So we have, if you will, the community pharmacy technology base at 92%, physicians using e-prescribing at 35%. So that's just one way that we can use this new dashboard to look at some of the data that is out there about our state or any other state that you might want to look at. Most of my family lives in another state, and so of course that was the second state that I chose to take a look at. So it's an interesting picture of this one particular issue in the e-health environment. I want to point out to you some opportunities that are coming up here pretty shortly. Next week, the Office of the National Coordinator for Health IT is having their annual meeting in Washington, D.C., and one of the 3 days is a public meeting day. That's on Wednesday. And you'll notice that the times listed are Eastern Time, but they have made arrangements for you to be able to join the webcast. So if you want to call and listen in on the webcast, we've got the link there for you. Many of us, as ARA high-tech grantees, will be at the ONC annual meeting, and you can follow all of the activity on Twitter, as you could if you also were at our summit early in November. We utilized Twitter, and it was a very interesting experience. I believe we might be having some technical adjustments that we need to make here, so bear with us for just a moment.
Okay. They've been telling us that the screen has not been advancing, so they may not have seen these slides up to now.
If you have not been able to follow along with me on the slides, I'm on slide number 10. My apologies, we did not realize that the slides were not advancing on the webinar. That was a challenge on our end, so I hope that we have resolved that issue. If we have, in the event that we have not, I will point out the slide numbers as I go through this, and I'll ask my other speakers to do that as well. So on slide number 10, you have the link for the public meeting day next Wednesday. The meeting has a variety of topics, which you'll see on slide 11. And I would point out to you that the stakeholder roundtable, which is occurring from 11:30 to 12:30, is going to be California is going to be well represented. We have a number of folks from California who will be participating in that, including David Lansky, Scott White from Dignity Health, and we're going to try to advance that slide here for you in just a second. There it is. So you can see they're going to be talking about meaningful use. Senator Mark Warner is going to be joining in the afternoon, along with another representative later in the afternoon. And the final discussion of the day, which will be at 1:30 California time, is going to be Health IT as the foundation for the three-part AIM. And if you don't know what that is, it would be a great opportunity for you to dial in and listen to the description both of what the three-part AIM is and also how Health IT is going to support that. We also want you to mark your calendar. This is a save the date for you. We will be having another HIE Stakeholder Summit similar to the one in November. and it will be May 8th and 9th here in Sacramento. One of the things that we heard from the group was that it was very valuable use of their time, and they'd like to do it again more frequently. So we will be hosting that again here in Sacramento in May. It will be the first day will be a half session that will begin in the afternoon, and then the second day, the 9th, will be a full day. So mark your calendars. As soon as the registration link is available, I will get that out to you. As we know, this past one we exceeded capacity very early on, so I would encourage you to watch for that, and don't hesitate if you desire to be there, to go ahead and register for it. And then, of course, I have an oh by the way for you. Since the summit, late in November, we published a State of California Progress Report specific to health information exchange. This was specifically to look backwards as opposed to looking forward. It was a review of where we had been since we started our statewide HIE efforts, and I think you will find it to be very interesting. We highlight a number of progress points, and you can set that beside our strategic and operational plan that you will find on our website, and so you'll have the opportunity to look at the history as well as a bit of the future in our planning for California. I have the link there. You can find that on the website as well. I believe it's under the news section, and I hope that you enjoy that document. It's a very easy read. It's not written from a technical perspective. It was really written for the general public, and so it's for some of you who read technical specs all the time. It'll be a very, very light read for you. So that's where we are relative to HIE in California from the Deputy Secretary's office. There's been a lot of activity, a lot of excitement generated over the past few weeks. I know I heard yesterday or earlier this week from one of our regional extension centers in the state. The LA High Tech reached 1,000 providers. They reached the milestone of 1,000 of their providers reaching meaningful use. So things are happening, and when they start to pick up that momentum, it tends to pick up very quickly from there. So we're very excited for you and with you about what's going on in California. I have asked today to have Raul Ramirez join us. He's the Chief of the Office of Health Information Technology at the Department of Healthcare Services, because Raul is one of the folks who is most interested in the numbers of providers reaching meaningful use in California, because Raul has the opportunity to distribute the EHR incentive programs through the Medi-Cal program. So Raul, are you there?
I'm here, Pam.
Okay, great. Will you give us an update on what's happening with the EHR incentive program?
Absolutely. There's quite a bit happening, and what is most exciting is that we are making payments to providers and seeing providers who had previously attested to adoption, implementation, and upgrade now coming in and registering for meaningful use. The slide that's up right now provides some information that was up to date as of a few days ago. For eligible hospitals, we've had 260 come in and register for their year one payments. Of that 260 that have started the process, 224 successfully submitted attestations, which we can now review and consider for payment. There have also been 62 hospitals that have come in and registered for year two meaningful use payments, and of those we've had 28 that have already completed the process and submitted signed attestations. Up to date, we have over $298 million that have been paid to eligible hospitals. The total number of hospitals paid is 207. In September, we did launch the Meaningful Use module for providers as well, and there's been some activity in that arena. The year one registrations continue to go up. we have 10,772 providers who have actually started the process, and a grand total of 8,000, a little over 8,000, that have submitted attestations for our review and approval. There have also been 2,500 providers who have come in and begun the registration process for meaningful use. That's very exciting news. And 97 of those providers have submitted attestations that they are using the technology meaningfully. Overall, we've made over $125 million in incentive payments to eligible professionals, and there are another 774 professionals that have been reviewed and approved and are expected to receive payment very soon. The department's taking efforts to try to review the remaining inventory as quickly as possible and really get to making those meaningful use incentive payments. Next page, please. And just some meaningful use updates. The Medi-Cal EHR incentive program, again, as I mentioned, made the meaningful use portal available on September 27th. Providers have been meeting meaningful use through Medicare and the Medicare Advantage programs as well. So as of October 31st of this year, the number of providers in California who have achieved meaningful use is significant. Medicare payments have been made to 6,253 providers for a total of $263 million, and there have also been Medicare Advantage payments totaling $147 million for approximately 8,531 providers. So that really, to show you how much this program has impacted the state to date, or at least through October 31st, total incentive payments to California providers has exceeded $833 million. So I think that's a lot of success in the program, both Medicare and Medicaid, and it shows that we are truly moving to the adoption of the technology and meaningful use.
Wonderful. Thank you, Raul. That's a very exciting number. I keep waiting for the day when that tops $1 billion, and we're not too far away from that now. So I'd like to turn this over to our TAG team. We have two members of our leadership team at California Health Equality, Scott Chrisman and Rem Coffrin, both who are known voices to you. For those of you who maybe just made a little bit of a connection there, several months ago I was able to introduce Scott as the Assistant Director at Cal-OHI, and he's not with me here anymore. He is still with me. He took this opportunity, this fabulous opportunity to go over and work strictly on the programmatic work around our federal HIE grant at UC Davis Medical Center and CHEC, and he's working with RIM, so they're going to give you an update on where they are at this point. Scott?
Thank you, Pam. I appreciate the opportunity to share a bit, and I certainly appreciate the opportunity to continue to serve in this effort in California. So in terms of our current activities, we've been ramping up the California Health Equality Program quickly. We actually have new office space here in Sacramento. Some of you might be familiar with the Cannery location. It's about a mile or so from the UC Davis Medical Center, which is obviously our home under the Institute for Population Health Improvement. So we're happy to be there. We're recruiting staff aggressively. I think we have a number of positions posted now to complement all of the key critical staff that came over from Cali Connect with the programs, and I'd really like to take the opportunity to acknowledge those folks for all the hard work during this transition. It's been an incredibly busy time, and we're looking forward to building further the team and moving forward with the programs together. Some of the things that are happening right now. Many of you are familiar with the grant programs for acceleration of health information exchange in California. There's a number of awards that have been announced, including a number of infrastructure awards that the contracts are being processed now. We're working through the new administrative systems for us with UC Davis Health System and getting those out the door. The Immunization Gateway Service contract is actually being finalized currently, and we expect it out in the next few days. We're excited about that work to begin. And then most recently, we just finished some selections for interface implementation support awards, and those will be announced and posted to the website, and again processed and gotten out the door to see that interface work proceed. So we're happy to see those programs and awards moving forward, and look forward to announcing additional opportunities here in the very, very short term. So please watch the CHEC website under the Institute for Population Health Improvement at UC Davis Health System. In addition to that, I wanted to mention that the first advisory committee meeting for the CHEC program will be convened on December 18th, so the week following the ONC annual meeting. Look forward to that group getting together to provide input into the programmatic work. And likewise, we expect from that to see additional subcommittees and task force convened as needed to advise on various programs going forward. So look for more there in the future. One last item I didn't even have time to put a bullet in. We just completed this morning and will be available by next week on the web is an HIO development guide. This will be another tool available to the community that really helps provide organizers of a health information organization by providing experience from others, lessons learned. It describes concrete practical steps in the community planning process that HIE should go through, stakeholder engagement, establishing governance, business planning, contracting with an HIE service provider, a number of practical guides and lessons to share, and we look forward to publishing that soon. We would like to appreciate all the work of the CHEC team as well as Lyman Dennis on producing the HIO development guide. So please take a look for that next week on the CHEC website. And with that, I wanted to turn it over to Rim Cawthorn, who's going to talk more about our work around directory and trust services. Rim?
Thanks, Scott. This month we'll concentrate on what we're doing in directory and trust services. It's one of a number of initiatives that we're continuing to move forward in the CHEC program. I'm actually going to talk about things in the reverse order that they are in the slide here, and start off with a meeting that was convened by ONC just last week. Aaron Seib and I attended out in D.C. The meeting was all about direct scalable trust, and what became very obvious early on in that meeting is that ONC is putting a great deal of effort into making sure that trust for the exchange of health information across organizations, across unaffiliated providers, especially using direct, is scalable, and that we're not looking only at being able to exchange information between organizations that have one-to-one trust agreements among them. I think one of the things that's so important about this is that it links directly to what we've been doing here in California in trying to develop a mechanism that HIOs, both community HIOs and enterprise HIOs, can trust each other to exchange information and what type of environment needs to be created there. If we turn to what we've been doing under the Western States Consortium project, for people that haven't heard me talk about that before, that project is specifically designed to develop the mechanisms, the trust mechanisms, and the directory mechanisms that are required for interstate exchange. We've begun a demonstration pilot of interstate exchange with Oregon, our partner to the north, as part of that consortium, where we're using direct to exchange PHI among providers for treatment purposes. It's a very limited use case that we're demonstrating there. However, it exercises many of the things that we talk about for directory and trust services, and in particular addresses the request from ONC for scalable trust. What we have done so far and launched concurrent with the summit last month was a trust community incorporating HIFs in multiple states, based on a consensus set of eligibility criteria for those HISPs that include both technical and business practices, and then developed a technical mechanism for sharing trust through sharing trust anchors among those organizations without the one-to-one negotiations and the one-to-one technical exchanges that are required within Direct today. We'll be expanding that over the next few months to incorporate additional organizations within the state of California and hopefully additional states within the Western States Consortium. And if we're successful, we'll be demonstrating that at the Interoperability Showcase in March. And when I say successful, we have every expectation that exchange will be successful, but we're hoping to make it onto the demonstration list with ONC. Finally, I wanted to follow up. The Western States Consortium pilot program is separated into 3 separate phases in demonstration. Phase 1 was the formation of a trust community and exchange of trust anchors to support that. Phase 2, which launched just today, allows HISPs to query each other for directory entries across state lines. And what we have now are 2 organizations that can discover the direct email addresses of providers in another community without having to call them up on the phone and get that information manually. In January, we will be expanding that to a federated approach so that we're, again, not looking at 2 organizations that interact directly with each other, but organizations that deal with each other through a state proxy that helps orchestrate the collection of information among all of the HISPs that operate within that state. And it is that final scenario that we're hoping to demonstrate at the Interoperability Showcase in March. The last thing that I wanted to follow up with then is to the point of getting to a federated approach for directory services in the state of California. We at CHEC have begun to add on to our technical staff internally and are beginning to build the orchestrator that helps provide a more streamlined approach to discovering direct addresses for individual or organizational providers within the state of California, and just today started having some success in querying multiple directories and collecting information back from them. I'm hoping to be able to share with you in the very near future additional success as we move that forward. And that's it. Pam, back to you.
Great. Now, what all of that means is we are getting closer and closer to the point where we can provide patient information electronically wherever and whenever the care is needed. This is the place where I promised several months ago that we would make certain that we did not go over our time limit and that we would leave lots of opportunity for you to ask questions. So, Val, if you're still on the line with us, would you please walk folks through the process for asking questions?
Okay, thank you. Ladies and gentlemen, if you wish to ask a question, please press star then 1 on your touch-tone phone. You will hear a tone indicating you've been placed in queue. You may remove yourself from the queue at any time by pressing the pound key. If you're using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question or a comment, please press star 1 at this time. And 1 moment, please, for the first question. And we do have a question from the line of Lucy Johns. Please go ahead.
Hi, Lucy.
Hello, everybody. This is a question for Rim. I'm wondering, Rim, whether you can elaborate a little bit on what you termed eligibility criteria in order to create this trust community that wants to relate through HISPs. And in particular, I think you said something about a state proxy in January. Can you elaborate on what that means and what that will be?
Sure. So to your first question, Lucy and a number of other stakeholders and I participated in some discussions over the course of the summer that resulted in some of what we're talking about there, where we were talking about the types of behaviors that a health information organization or health information service provider providing direct services might have to go through in order to be a trusted organization. And we, at the time, were talking about accreditation and an accreditation program. The eligibility criteria under the Western States Consortium is, I'd probably describe as a lightweight version of accreditation, where organizations attest to their behavior and are therefore considered trustworthy for the purposes of this pilot program. Part of the discussion at the ONC meeting just last week was formalization of an accreditation program for health information service providers, and one of our tasks that I didn't talk about as we move forward will be to take a look in a little bit more detail on the need for accreditation of organizations like that that might provide a more robust set of eligibility criteria. To the second question, the mechanism today for understanding information about an individual provider with whom you may want to exchange information is usually talked about in terms of a provider directory. And most organizations maintain a provider directory that as long as you are part of that organization, you can find and communicate with other providers within your organization. When you talk about getting across boundaries between organizations, that becomes incredibly difficult to do. What we're doing is putting together a mechanism that allows a provider in one organization to ask a statewide service for information on how to communicate with other providers within the state, or through what we're doing with the Western States Consortium with providers outside the state. It again allows you to do that without having to contact every single organization in the country and question them individually in order to get an answer. A proxy is one of the ways that that service has been described.
Thank you.
Great. Lucy, thank you for the question. That was a great question. Val, do we have another question?
And once again, if you have a question, please press *1 at this time.
And I know some of you may be a little shy about asking your question on an open line, so I want to again point out to you that if you want to contact us, if you have a question for anyone on the team, whether they've been on the call today or in previous calls, or if you just have a general question, please go through eHealth@chhs.ca.gov. It's there on your slide, and we will route that question to whomever is the correct person to have it, or any comments. We particularly like compliments, so comments, complaints, or compliments, please feel free to put them through at that address. Val, is there another question?
Yes, we have a question from the line of Will Ross. Please go ahead.
Hi, Will. How are you?
Good. Can you hear me?
I can.
Oh, good. This question is for Rim. It's a follow-up on what Lucy was asking. Actually, it's a kind of a drill down into the ONC Scalable Trust meeting. And in particular, I wondered if you could comment for a moment about the potential role that was imagined for directtrust.org in terms of establishing a national trust fabric.
Sure. So directtrust.org is a group of individuals that have become very interested in moving forward the whole idea of scalable trust. Directtrust.org just recently became a membership organization. It has a large number of members now, primarily EHR vendors and health information service providers interested in providing direct services, and recently entered into a contract to provide accreditation of direct service providers. I think that Direct Trust sees itself as providing accreditation services, helping to establish that HISPs are to be trusted in the exchange of information by not just having them attest to, but inspecting and monitoring their business and technical practices, so that you have some assurance that they do the right things to protect PHI through their business and technical practices. They also plan on putting together a mechanism for distributing trust However, they don't see themselves as providing any governance at all and do not see themselves as establishing a trust community, but instead providing services on a national scale to organizations that do want to build those communities. Direct.org was part of the meeting last week, and was accreditation, and what they're planning on doing is a large part of the discussion last week.
Great. Well, thank you for that question. Val, do we have any other questions?
Thank you. And once again, if there are any additional questions or comments, please press *1.
I learned so much from listening to RIM. I hope that those of you on the line do as well. And, well, that was a great question for calling out a little bit more of the detailed information. We try really hard on this call not to get too far down in the weeds, but it's always nice to have an opportunity to add something extra based on the questions. So anyone else have another question, Val?
And there are no further questions.
Okay. Well, that means we must have answered everything that you could possibly want to know today about the eHealth landscape in California. We have the slide deck. This call is on the eHealth website, and the audio will be posted in about 2 weeks. So if you know someone who wanted to listen in but didn't have a chance to, you can point that out to them. We are going to have our next stakeholder webinar on Thursday, January the 17th. So please mark your calendar for that. It will be at our usual 1 to 2 p.m. time. And we hope that you have a wonderful, safe, and healthy holiday season. We're off to Washington, D.C. to find out what the national coordinator has in mind for us for 2013, and we will bring that news back to you and share it with you in January, if not before. So with that, let me sign off, and again, wish you a very happy, healthy, and safe holiday, and I will see you around California.
Hey, thank you. Ladies and gentlemen, that does conclude our conference for today. Thank you for your participation and for using AT&T Executive Teleconference Service. You may now disconnect. And ladies and gentlemen, thank you for standing by, and welcome to the California eHealth Stakeholder Webinar Conference Call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during the call, please press * then 0. As a reminder, today's call is being recorded. I would now like to turn the conference over to our host, Ms. Pam Lane. Please go ahead.
Good afternoon, everyone, and welcome to the December stakeholder call. We are delighted to have you here. It is so difficult at this time of year to pull people away from all their activities, and I'm glad that you joined us. It's difficult also for me to realize that another year has gone by. Here we are in December, and it has been an incredibly busy year for all of us. One of the things that we did was to develop a very short and succinct eHealth vision for California, and you can see it there on your screen. And of course, we developed eHealth goals to go along with it. And those goals, of course, are to enhance individual and population health outcomes, ensure secure data access, and engage patients and families as partners in care. As I start, I would like to remind all of you that you can communicate with us as well as stay engaged and up to date on what's going on in the eHealth world in California by accessing our website that you will see on slides throughout today's presentation. It is ehealth.ca.gov, and we hope that you will utilize that website as well as the new Cal OHI website, which is OHI with 2 I's, .ca.gov. One of the things that you will find on the website is the videos from our Stakeholder Summit that we held early in November, actually the 1st and 2nd of November. And I wanted to do a recap. I saw many of you there. It was very exciting. Our speakers were very engaging as well as informative, and it's a great opportunity for me not to have an opportunity to put names and faces together, but also to have a chance to talk with you individually as well as collectively about what's happening and what you would like to have happen regarding eHealth in our state. We had 425 attendees. We had a waiting list of about 100 people that we were not able to accommodate. But these, the 425 attendees were stakeholders from health information organizations, regional extension centers, provider groups, health plans, hospitals, government, consultants, vendors, and consumer advocates. It was a very exciting, very energized room of folks who were there to learn and to share. This was our 4th statewide summit. And one of the interesting facts that came out of analyzing the attendance was that 2 out of every 3 attendees had not previously attended one of the summits. So it was actually a little bit higher than that. It was between 60 and 75% of the folks that were there were new to the summit event, and it was very exciting because to me that represented folks who maybe were not paying attention to this eHealth world, or maybe were and were too busy to attend the summit, but folks who were new to the group, new to have their voice added to the discussion. We did a survey, and we had about a 30% overall response rate to the survey. 95% rated the summit very good or good, and 91% said the topics were very good or good. It was a day-and-a-half format, and that was new, and people said they tended to like that a lot. They did ask that for future planning.